3 points. If you don't remember anything else from my presentation today, remember these 3 points. It's really kind of critical. Okay, so firstly, if you don't enroll in Medicare on time, you're going to pay a monthly penalty. And incidentally, that's not a one-time penalty. That penalty lasts the rest of your life. So you want to make sure you sign up when you're supposed to sign up for Medicare. Number two, if you don't get the right private insurance, and so right there, if you don't know that there's private insurance that works with Medicare, well, now you do know. So if you don't get the right private insurance to go with Medicare, you may be paying too much in premiums for your healthcare coverage in retirement. And essentially, there are 3 areas where private insurance works with Medicare. Number one is your supplemental coverage. Okay, so that's the 20% that Part B, as in boy, does not pay. Secondly, there's your Part D coverage or your prescription drug coverage. That's provided by a private insurance carrier. And then thirdly is something called Part C or Medicare Advantage. And when you know that there's private insurers involved, what you know you can do is shop around. So make sure that you're looking and seeing what is the best deal for you and your husband or you and your wife, or for you personally if you're single, that's out there. Okay, so make sure you shop around. And then lastly, if you don't plan for higher healthcare costs in retirement, it could put a real crimp in your retirement planning. And what I mean by that is that the cost of healthcare seems to be increasing percentage-wise per year higher than your cost for milk and eggs and that type of thing. So even in the planning that I do, I include a little higher 5.86% COLA, if you will, cost of living adjustment, in my healthcare costs and other costs. Case in point, the Part B deductible last year was $148.50, and this year it went up to $170.10. Now, that's a 14% increase. Just to my point, you want to make sure you level set that. I'm not saying it's going to go up 14% every year, but you want to make sure that you keep an eye on that. Okay. So as far as my agenda goes, I'm going to talk about what is Medicare, who needs to enroll in Medicare, and when. Okay. And then how do you do it? Simple thing. How do you enroll in Medicare? People ask me that, and you should know. So just part 2 of my agenda, Medicare and that private insurance I mentioned. How much does Medicare cost? Everyone should know that, so you could build a proper budget. What does Medicare cover? Almost as importantly, what doesn't it cover? Medicare does not pay for everything, and we'll go through that. And then how does this private coverage, private insurance, work with Medicare? All important points. So part 3, 2 reasons your healthcare is going to be higher in retirement. Okay, one is inflation. Right now, inflation is a little high. Okay, we're in January of 22, a little high. And there's going to be an increased need for services as you age. So as you get older, hips are going to go bad, knees are going to go bad. It's just a factor out of life. And as those things give you more challenging issues, your costs are going to go up to maintain your standard of living. And hopefully not surprising to anybody, but Medicare does not cover long-term care. It'll cover up to 100 days of long-term care if what you are needing to receive is skilled care, and that's really under direct supervision of a medical professional. But the moment you don't need that care anymore, you go to something called custodial care. And if that's after 20 days of Medicare paying, and then you go to custodial care because you don't need that level of skilled care any longer, well, then you're on your own. Medicare does not pay. And Medicare will only pay up to 100 days. So it's by no means long-term care coverage at all. So Medicare enrollment, let's talk a little bit about that. So who pays for Medicare in the U.S.? Well, before age 65, there are your choices. You could be on an employer group health plan. You could have a retiree health plan that you worked long enough at the company you're at and you were eligible for retiree health insurance. You could have COBRA paying. Individual health insurance, like myself, I'm a small company. I have individual health insurance that I went through a healthcare broker and received, or other. And then and other could be, military type benefits, that type of thing. But now after age 65, very important, Medicare is your first payer. So, and then the other insurance pays second. Now, Medicare is your first payer, but I have a little parenthesis there on the chart. It says, except employer group plan that covers 20 or more employees if you or your spouse are still working. So if you turn 65 and you elect to continue to work, and you're on your coverage plan of an employer who is 20 or more people large, well, you can stay on your group health plan. You do not have to go over to Medicare. This is what one of the three options are of how to sign up for Medicare. If that's your situation where you're age 65 and you elect to continue to work, and you're at a large company, I don't know, Exxon or J&J or something, well, you don't need to sign up for Medicare. You would be what's called a special enrollee when you go to sign up later. Okay, so totally legitimate, totally legitimate. Okay, what does this mean? Well, unless you're covered by an employer group health plan that covers 20 or more people, you must enroll in Medicare when you turn 65. So look at my situation here personally. When I turned 65, I have a small group here that I work with, certainly less than 20 people. So when I turn 65, I'll have to go on to Medicare as my primary provider for healthcare services and retirement. I bring that up because there are plenty of small CPA firms and small law firms that have 15 people in there, and yet they don't know that when they turn 65, they have to get on Medicare. So I don't know if it's a well-kept secret or what, but I'm trying to get the word out that if you work for an entity that's smaller than 20 people, you have to come off that group health plan and go on to Medicare. Those are the rules. Okay, that's what you have to do. Okay, so what if you don't enroll in Medicare on time? Well, you may pay late enrollment penalties, and as I said, that's not just a 1 month penalty and then you're done. You pay that penalty for the rest of your life. Your healthcare expenses may not be covered by insurance. Certainly not a situation that any of us want to be in. And your private insurance options may indeed be limited or a lot higher, i.e. more expensive. So what is Medicare? Well, it's the National Health Insurance Program for people 65 and older. It's administered by the Centers of Medicare and Medicaid Services, CMS, in other words, and you enroll through the Social Security website. So you go to www.ssa.gov, and that's where you enroll in Medicare. All right, and then who is eligible? Well, everyone who's over 65, so all U.S. citizens. If you have been a legal resident who've lived in the U.S. continuously for the last 5 years, you could also qualify. And interestingly, some people under the age of 65 can qualify if they've been on Social Security disability benefits for the last 2 years. So that's kind of in a nutshell, who is eligible.